medicine is an art. It is a true art that we get to learn during our study during the medical school and residency and fellowship and whatever training we get. We learn the art on how to heal patients, how to help them in that path of healing. And there is also an art in how to manage our practice in medicine, the art of how to be efficient and effective. This is the word of efficacy. I'm Michael Marcos. I'm an endocrinologist at Indiana University School of Medicine, and I'm so lucky to get to practice medicine in an academic setting. So I get to practice the clinical medicine and the academic medicine. And I got so intrigued about the art of how to practice medicine outside of actual knowledge of medicine, the art of how to be efficient and effective. And that's why I came with the idea of MD efficacy, that combination of the two words. Efficiency is easy to understand. You want to start on time and finish on time while having everything done. So you don't want to work after hours or before hours. So if my clinic goes from 8 to 4, I start work by 8, 7:50 around that time, and I finish work by 4, 4:10, 4:15, not later than that. And then there is no work outside of that. And to expand on the efficiency, can I see more patients in that time interval? And it became like a game when I'm challenging myself, how far I can go while still being very effective. So this is the efficiency part, how fast you can climb the ladder. And then effectiveness. And in effectiveness, I mean getting the right job done. As a physician, I'm treating patients. So I wanted the patients to have good results. As an endocrinologist, I treat patients with diabetes. If they really work on it, can we achieve A1C below 7, below 6.5%? My main focus of practice is the thyroid. Are my patients with overactive thyroid are being well controlled? Hypothyroid, are they well controlled and feeling well? The same applies to any specialty. Am I getting good results? This is the first aspect of effectiveness. But there are other aspects of effectiveness. Are the patients satisfied with the care? We are living in an era where all of the patients get to write reviews about you. So are you having good reviews? Are the patients satisfied? We get audited for quality metrics or assessed for quality metrics. Are the leaders happy with the results I'm having in my quality metrics? It gets to be very exciting and interesting when I have trainees in the clinic. And these trainees, when they come, they want to learn medicine, which is very valid. But then I ask them about everything else outside of medicine. Do you know how can you maintain good patient satisfaction scores? Do you know the quality metrics and what we get assessed for? And also, do you know the billing and coding, which is another part of effectiveness? Am I productive or not? Do I know the ins and outs of the billing and coding? And I remember as a fellow, there was a billing and coding course offered by one of our societies. And I asked all of my colleagues and actually mentors if they want to join me in attending that coding course. And as you can imagine, no one wanted to join. But then when I came back from this 2-day course, gosh, it was very enlightening. And my approach to billing and coding is very different. And then I got to understand that what we consider as complex, maybe for CMS, the Center for Medicare and Medicaid Services, and the American Medical Association, who set these billing and coding guidelines, it is not complex. And what I may consider as very simple, they may consider as complex. And then, in order for us to come into a middle ground, we need to have a common language that is written in the notes. And this is when my insight about the notes as well got to be different. It's a very important topic that I'm gonna get to talk about as we move forward. But back to the idea of efficacy, how to be efficient and how to be effective. Very important. during our training, we get to learn medicine well. I hope we get to learn it well, right? We spend tons of years in investing in ourselves to learn medicine. So usually, physicians are doing pretty well from the medicine standpoint. And I'm not planning to talk about medicine. But what we don't get to learn is how to run a practice, how to be efficient, how to ensure that the other aspects of our lives are well maintained. Imagine our lives as a house, and then this house has walls. In the medicine and that career, we are building one wall, and we hope that we are building it very well. Maybe added to that wall wealth. So we hope that we're gonna get productive and we're gonna have good revenue and get good return on our investment in learning medicine and practice in medicine. But then there are other walls. There's the social aspect. There's the family. If you have a family, this is very important. Your presence in your family is crucial, and no one going to replace you there. Your community, if you are active in the community, it is great because it completes our personality and our mission in life. Career is not everything. Medicine is not everything in our lives. And it gets to be very challenging when we don't have good boundaries. And when we say, no, stop, no more work after hours. Oh, I'm done with the clinic. I'm not opening my electronic health record. I'm not getting to my in-basket or inbox. I'm not getting to these labs or messages or phone calls or pre-charting for the next day. I'm not doing that. I'm focusing on what I need to focus on right now. This is not easy. And actually, we learn the complete opposite during our training. We learn that if you call the patient at 9 or 10 p.m., you are a great physician. You are very invested in patient care. I think this is completely wrong. It just messes up our lives. And then I feel so sad for some of my mentors who were great physicians, but then they had destroyed families, whether ended in divorce or kids with addictions, or those who were very active in the community or had hobbies that they are no longer doing them because patient care took over all of these. We don't want that. We don't want to live a life that is good, fulfilled. We do very well during our work hours and we get everything done so that when we leave home, there are no tails. I think this should be the goal. This is the goal for me, for myself, and I recommend you to have the same goal in your life as well. I would like to finish here by having a suggestion for you. We can choose to be one of two things: a complainer or a doer. A complainer, we see the problems, we feel the problems, but then would we do something about the problems, or would we just complain about them? If I am in your shoes, I will recognize the problem and I'll do something. I'll act on it. That's why I got so interested in that topic. I got so interested in that continuous quality improvement. Every 1 or 2 weeks, I'm making some change. I'm working on refining something. I'm helping building something. And as we build it one step over the other, over months to few years, you can see a huge difference in how you are practicing. And also that's why I wrote the 2 books, No Work After Hours, to make sure that we don't work before or after hours, and Physician Productivity Secrets or Physician Revenue Secrets, so that we can understand how truly we can make money. How can we adjust our workflow and work on it? I'm planning in this YouTube channel to have regular videos so that I can share some insights and some thoughts. And please, if you have questions, don't hesitate to reach out. We'll see you in the next video.